The American Journal of Psychiatry has issued a major correction to the findings of a study on transgender surgery and its mental health benefits. When the study's authors reanalyzed the data, they found, quote, the results demonstrated no advantage of surgery in relation to subsequent mood or anxiety disorder related healthcare visits or prescriptions or hospitalizations. Joining me now on Skype to talk more about this is Ryan Anderson, Senior Research Fellow at the Heritage Foundation and author of the book When Harry Became Sally, Responding to the Transgender Moment. Ryan, welcome back to the show. Good to see you. So how did the study's original findings get this so wrong, and what exactly led to the correction?
You know, no one really knows where the original study, the authors went wrong. You could chalk it up just to a good faith mistake. Sometimes scholars make mistakes like this. Other people have speculated that, look, there can be motivated reasoning, that there was a preferred outcome. This is obviously a politically salient topic. There's political correctness that's associated with this topic. And so they might have been looking for a preferred outcome. I don't know. And I don't kind of want to, cast judgment there. The reason that the correction was issued was that 7 different letters to the editors were written to the journal from a whole host of well-credentialed, serious researchers and medical doctors pointing out the problems with the study. And I think we should count this as a good sign that they did issue the correction, because patients need to know the truth about what medical care is in their best interest if they're suffering with gender dysphoria.
Ryan, how do these findings compare with other studies on the quality of life before and after gender reassignment surgery?
Sure. So the largest data set and the longest running study was a study out of Sweden from 2011. And it also showed that there wasn't the benefit to transition care that the media frequently touts. And its most startling finding was that there was a 19 times greater likelihood of death by suicide for patients who had had sex reassignment procedures, and that those suicides didn't take place until 10 years after the surgery. And the reason I mention both of those things is that many studies of sex reassignment procedures don't look at 5, 10, 15, 20 years later. They look at, the next year, maybe the next couple of years. And so it's important to look long term. This particular study didn't look at either attempted suicide or completed suicide. It looked at mood disorders and anxiety disorders. It found no improvement for either hormonal or surgical transition on those issues. And it actually saw that there was an increase in anxiety disorders for people who had the surgical transition.
Ryan, as someone who's studied and written on this issue extensively, what do you think seems to be the best course of action for those patients with gender dysphoria? What do we know?
Sure. So the doctors who I've talked with on this, including the former head of psychiatry at Johns Hopkins Hospital, say that the problem here is not with the patient's body. And so the remedy here is not going to lie with transforming the body. The problem here lies with the patient's thoughts and feelings. And so the proper remedy is to help the patient line up their thoughts and their feelings with the reality of their bodies. The proper therapy here is going to lie with counseling, not with hormones and surgery.
Well, Ryan, thanks so much for your time today and for your analysis. We always appreciate it. Ryan Anderson, Senior Research Fellow at the Heritage Foundation and author of the book When Harry Became Sally, Responding to the Transgender Moment. Thank you again.
Thank you.